Hey, what's up guys? Welcome back. So in this video we're going to talk about Wernicke-Korsakoff syndrome. Now this syndrome can be a little bit confusing, especially if you don't understand how the biochemistry is involved in the pathology, but what I promise to do is take you through it step by step and show you how in fact things can actually be quite logical once you just understand the basics really. So let's go through it. So as I said, things can be random, but we're going to go through it step by step, and hopefully the confusing big picture that we study in the textbooks will all make sense. So the first thing that we need to do is understand that, number one, Wernicke-Korsakoff syndrome is actually split into two different conditions, or this is what a lot of the doctors agree on. So the first condition is Wernicke's encephalopathy, and the second condition is Korsakoff encephalopathy. Okay. So what you should understand from the get-go is that Wernicke-Korsakoff syndrome, essentially what it is a decrease in thymine. And thymine is vitamin B1. So because there's a deficiency in thymine, the patient's first going to present with signs and symptoms of Wernicke's encephalopathy, and then the patient's going to progress over time if he or she is not treated, and they're going to present with signs and symptoms of Korsakoff encephalopathy in addition to Wernicke's encephalopathy. Okay, so the question is, who suffers from this condition? That's really important to understand. And the answer is, number one, alcoholics, and number two, malnourished people. So why is that? Well, alcoholics, if you remember from biochemistry, when you want to metabolize alcohol, when you want to break it down, you're going to use up a lot of thymine. So alcoholics will have a tendency to have a decreased thymine. Also, malnourished people, they will have a decrease in thymine because their diet is insufficient. They're not getting enough thymine from their diet. So first important point to remember, who does it affect? Now, the second question is, what does it affect? That's really important for the pathology. And the answer is specific nervous system structures. So why is it so important that you understand the specific nervous system structures? Because each structure that's affected will develop a specific symptom. So what are the clinical presentations of Wernicke's encephalopathy specifically? The first one is visual problems. So the patient may present with ophthalmoplegia or nystagmus or other visual problems. And then the second symptom that the patient will present with will be movement-related problems. So things like ataxia and coordination problems. So you might be thinking, it doesn't really make sense. How does thymine, a decrease in thymine, what's that got to do with visual problems and movement problems? Well, it doesn't make sense now, but hopefully I'm going to show you how it does in fact make a lot of sense. So how do you treat these patients? Well, it makes logical sense. If the patient has a decrease in thymine, then you want to increase their thymine, obviously. So you give them thymine. So that was talking about Wernicke's encephalopathy. Remember that we said that Wernicke-Korsakoff is split into two, Wernicke's encephalopathy, and then over time, if not treated, they would develop Korsakoff encephalopathy. So what's the Korsakoff part? Essentially what this is all of the previous symptoms of Wernicke's encephalopathy, but now you're going to add on to it amnesia type symptoms. So the patient is going to have anterior grade amnesia and retrograde amnesia. They're going to suffer amnesia. Essentially is memory loss, if you didn't know that. So and if you're wondering what's the difference between anterior grade and retrograde, essentially from the moment the problem happens up to the time that the patient presents, to the clinic, they will lose all of that memory. They won't be able to remember things during that period of time. That's anterior grade amnesia. Whereas retrograde amnesia is the patient will lose memory of things that happened before the problem even. Okay, and then something that's quite special that happens in Wernicke-Korsakoff syndrome is that because the patient has lost memory, what they're going to start to do is try to confabulate, try to make up stories that are not true, to kind of fill in the gaps of their memory loss. So you might ask a patient, also, what did you do last weekend? And it's the family clearly said that the patient was in the house, but they said, oh, I went here, I did this, I did that, I did this, because they're trying to fill in gaps of memory loss. So how do you treat this Korsakoff encephalopathy? Again, you just increase their thiamine. So why? So far, nothing really made sense. What's the link between thiamine and these symptoms? Why is why are all these symptoms occurring? So it's a little bit annoying to just memorize this, but if you take the next few minutes to try and understand, then it will be a lot easier to remember because things will just make sense. So, as promised, let's take it step by step and understand this condition perfectly. So, we said that the main problem with Wernicke-Korsakoff syndrome is a thiamine deficiency. So that's a vitamin B1 deficiency. So that's why you see that alcoholics and malnourished people will suffer from Korsakoff syndrome, or the most common people that suffer from Wernicke-Korsakoff syndrome are alcoholics because they're using up a lot of thiamine in their metabolism, and also malnourished people because they're not getting enough thiamine in. But why is this important? What's thiamine got to do with this condition? Well, if you notice from the symptoms tended to be quite neurological. Eye movement, eye problems, movement problems, these are all these are kind of related to the central nervous system. And if you remember from your biochemistry, thiamine has a very important role when it comes to the Krebs cycle, when it comes to creating energy. But if you don't remember biochemistry, then it's okay. For now, just remember that in Wernicke-Korsakoff syndrome, thiamine has a very important role in the CNS when it comes to the myelination of nerves and ATP synthesis. These are really important things that thiamine is involved in. So, but why is that important? Why is it important that myelin has these kind of functions? It's because this basically means that if thiamine is used in the brain for myelination and energy, the areas of the brain that require the most myelination and require the most energy, these are going to be affected the most, and they'll be affected first when you have a thiamine deficiency. That makes sense, right? So let me just repeat that. So the areas of the brain that use the most thiamine will be affected. So hopefully things are starting to make a little bit more sense. But if they're not, let's move on. Okay, so how does thiamine deficiency relate to the symptoms? Well, what it is that each symptom of the Wernicke's encephalopathy that we talked about, so the visual problems or the movement problems, or the symptoms of memory loss that we talked about that were associated with Korsakoff, these are all related to problems that occur in specific structures of the brain. So structures that are involved with eye movement will be affected by a decrease in thiamine. problems or structures to do with movement in the brain will be affected by a decrease in thymine, and structures to do with memory loss or with memory will be affected by a decrease in thymine. So that's why it's so important to understand that thymine is associated with energy and myelination. The structures that require the most thymine and energy, that require the most energy and myelination, will be affected first. So in other words, basically what I've written here is that these structures of the brain, they are the most affected by demyelination or a decrease in ATP synthesis. Okay, so clearly there are going to be some kind of symptoms that occur if these structures of the brain are damaged. So hopefully it's making a little bit more sense now. So the question you're probably asking is then, okay, just tell me, what are the structures then? What are the names of these structures that are affected? So let's look at the structures exactly. So there's 3 that you need to know for Wernicke-Korsakoff syndrome. You need to know the structures that are to do with eye. So these could be your midbrain, because that's where your third cranial nerve comes out of. It could be your pons, because that's where your trochlear nerve, your abducent nerve comes out of, and your medial longitudinal fasciculus, which ascends through the brainstem, because that's how you get coordination of eye movement. So when your left eye moves laterally, your right eye will move medially, and when your right eye moves laterally, your left eye will move medially. That's how you get coordination of eye movement. The second one is your cerebellum. Okay, this is going to be affected. And then your structures to do with your memory, so your mammillary body and your hypothalamus, your limbic system and your frontal lobes. Remember, your limbic system is to do with short-term memory, to do with long-term memory. So let me just say here, to make your life a little bit easier, your midbrain, pons, medial longitudinal fasciculus, you don't really need to, if you don't want to, it'll be good. And your mammillary body, limbic system, frontal lobes, you don't have. Just for now, remember these 3. It would be amazing if you could remember these though. So, as a summary, Wernicke-Korsakoff syndrome is caused by a thymine deficiency. Okay, so you could be an alcoholic or you could be malnourished. So when you have thymine deficiency, what happens is that you're going to initially suffer from Wernicke's encephalopathy. And that's because structures to do with eye are going to be affected. So it could be your midbrain, pons, medial longitudinal fasciculus. So you're going to get visual problems, obviously. You're going to get things like ophthalmoplegia, nystagmus. At the same time, your cerebellum is going to be affected. And obviously, if your cerebellum is affected and its function is coordination, tone, and there was a third one, it doesn't really matter, you're going to get movement problems. So you're going to get ataxia, you're going to get coordination problems, as I said. But then over time, if you still have a decrease in thymine, okay, vitamin B1, and you're not treated, your Wernicke encephalopathy is going to progress into Wernicke-Korsakoff encephalopathy. And what happens there is that in addition to structures of the eye, structures to do with eye movement and your cerebellum, structures to do with your memory are also affected. So this will cause amnesia. So you're going to get retrograde problems, or anterograde, retrograde problems, and the patient is going to start to confabulate and make up stories. So I hope you understood from this that Wernicke encephalopathy, Korsakoff encephalopathy together are known as Wernicke-Korsakoff encephalopathy. So just to reiterate, it's a progressive encephalopathy. It's due to a decrease in thymine. Basically, structures to do with eye movement and balance movement are going to be affected first due to a decrease in myelination and ATP. This is known as Wernicke's encephalopathy, and this is going to create those symptoms that we mentioned. After a prolonged period, memory structures of the brain, and this is going to create amnesia-like symptoms. So how do you treat this? The answer is give the poor person thymine, because that's what's causing the whole condition in the first place. So thanks a lot for watching. This video did go on for a little while, but I hope it was worth it. I hope that now you understand clearly the concept of Wernicke-Korsakoff syndrome, and now hopefully when you go and study in the textbooks, things will make a lot more sense for you. Thank you very much.